The report examined 6 key areas: pandemic preparedness, lockdowns and social distancing, testing and contact tracing, social care, at-risk communities, and finally, vaccines. While the rollout of jabs is held up as a big success, the rest says the report were anything but. Our chief correspondent, Tessa Chapman, reports.
The failings are familiar, but now they're in black and white. As coronavirus took hold around the world, the UK was too late to lock down, too slow to test, too blind to the impact on care homes. That acknowledgement is a relief, finally.
We were actually being blamed at the time. It was our fault that COVID entered the homes. It was our fault that we didn't have the right PPE. It was our fault that people weren't getting tested.
From the start, the focus was drawn to hospitals, not social care, MPs found, and that and other early decisions cost thousands of lives. The UK should have borrowed strategies from Asian countries, better prepared for a coronavirus pandemic while we were ready for flu. Assumptions that people wouldn't accept lockdown led to a failed herd immunity path.
Faced with scepticism that the public would obey lockdown measures, people were too fatalistic that there was no alternative other than it's progressing through the population.
And did that fatalism do serious harm?
It did do harm because what it meant was that we were late in locking down. Everyone now accepts this.
The report criticises the gradual approach to lockdown, social distancing and isolation. A test was developed early, but test and trace was slow, uncertain and chaotic. The government is pointing to the positives.
We acted throughout on the basis of the scientific advice. We moved quickly to protect the NHS from the surge that we saw in countries such as Italy, and we saved lives in particular through the fast deployment of the vaccine programme.
The vaccine research and rollout programme are praised, the flexibility of the NHS too, but there are warnings from within that lessons can't be learned too soon.
We are still in a pandemic, and as we speak, we still are seeing death rates in the UK, hospitalisation that are far higher than our European neighbours, and we still have the inequalities affecting ethnic minorities. 30% of people in intensive care at the moment come from ethnic minorities.
And people who've lost loved ones are worried for the future.
What the MPs have done with this report is attempt to hold them to account, hold the government to account, and that's why I'm grateful for it. But it's not enough, and I fear very much for people who are currently alive today and won't be in the coming days, weeks and months because the government hasn't learnt its lessons.
The government has committed to a full public inquiry on the pandemic starting next spring. This, though, the first major verdict, is an indication of what's to come. Tessa Chapman, 5 News.